It is a great honor and privilege to have you witness this epic occasion of the commissioning of the school clinic here at the School for Special Needs, Apata Yakuba. In achieving universal health coverage, healthcare services must be available, affordable, and of good quality, bringing it closer to the populace. The good people of Kwara State have been enjoying quality and affordable healthcare services under the Kwara State Health Insurance Scheme since the year 2020, at the peak of COVID-19 pandemic, when everything else was failing. Through the magnanimity of our governor, Malam Abdulrahman Abdulrazaq, to launch access to care at that most critical period. The population segments under coverage of the scheme are divided into three, namely the formal sector, the informal sector, and the indigent sector. Though the agency is yet to cover the formal public sector, we have been enrolling from the informal sector and the indigent sectors of the population. The premiums for the indigent sector of coverage are fully subsidized through funding from the state government, the federal government, and through sponsors, donors, and partners. Complementary to the effort of making sure that all the segments of the population are covered, assessments and continuous quality checks on a quarterly basis across all facilities accredited by the Kwara State Health Insurance Agency. These include public and private facilities across the state to ensure that quality improves commensurate to caregiving by all providers to all beneficiaries. Currently, we have about 65 accredited providers across the state, spread across the 16 local government areas of the state, who are able to provide both primary and secondary services, while we have about 142 accredited primary healthcare facilities spread across the state to be able to provide primary services to the population segments in their catchment areas. These primary healthcare facilities are able to refer cases, secondary cases, to accredited secondary providers whenever secondary services are required. The agency, in order to bring quality services closer to the populace, commenced implementation of innovative initiatives to improve quality of the facilities and to make them available to provide healthcare services whenever needed. The School for Special Needs Clinic was one of the facilities that was earmarked for one of such interventions. The population of students in this school require assistance for their daily needs and are unable to seek for medical services outside of the school premises. The need to rehabilitate the clinic became necessary to be able to get the clinic to pass assessment and to get accredited to provide healthcare services under the Kwara State Health Insurance Scheme. To be able to finance the project, the students form part of the indigent and vulnerable population had to be registered and enrolled to be able to draw funds down to the clinic, who is now an accredited healthcare provider to provide primary services in the state. Once the students were registered and enrolled to receive healthcare services under Kwara State Health Insurance Scheme, capitation payments then began to accrue to them on a monthly basis. Monthly capitations that are due to the clinic was then used as a leverage to qualify for an upfront loan from the Kwara State Health Insurance Agency, and the repayment for the loan is what is drawn from a percentage of their monthly capitation. The rehabilitation covered repair of structural defects, water reticulation of the facility, construction of an overhead tank mount, purchase of an overhead tank, septic systems, painting and tiling of the entire floor of the clinic, and carpentry and plumbing works. It also covered furniture, medical equipment, and beddings. It will also cover drugs and consumables once the students resume back to school from their holidays. For secondary and after-hours services, the agency has already contracted with an accredited service provider who is able to come to the school to attend to their needs, and the students referred for further care if necessary. This project is a testament to what innovative health care financing can do to change the healthcare space and landscape as we begin to change the narrative about our healthcare system in Kwara State and the nation as a whole.